Hello class, my name is Sammy Kolosik and my PowerPoint is on thrombosis, deep vein thrombosis, and pulmonary embolism. So in this presentation, I'll cover how these are all related and how they cause one another. So patient X, Thomas, is an overweight and single 55-year-old man who has had swelling in his right foot and right ankle for the past 6 days. He's also complaining of pain in his right calf. He says the pain has gotten worse over the past 2 days and rates it a 7 out of 10. His history includes a previous episode of DVT at the age of 50 and type 2 diabetes mellitus. His smoking history includes smoking 1 pack a day and smoking 28 packs a year. As well, he drinks 3 to 4 beers a day during the week and drinks a 6-pack per day on the weekends. Thomas is admitted to the hospital with a preliminary diagnosis of DVT, and for his current symptoms, which include sudden shortness of breath, hemoptysis, and pleural friction rub. So the etiology of DVT. A thrombus is a blood clot, blocking blood flow in a vein. And once this happens, the stoppage of blood flow causes a formation. Clotting factors such as immobilization, so perhaps a long flight on a plane where a patient is not moving very much, is mostly sitting down, which is known as venous stasis, or trauma or infection known as venous endothelial damage, or coagulation disorders known as hypercoagulable states. All combined are what's called the triad of Virchow, and these are the main 3 contributors to DVT. So the etiology of a pulmonary embolism. Pulmonary embolisms occur when that thrombus or blood clot travels from the original site. Usually that's going to be the lower extremities. It'll travel up the bloodstream and to a pulmonary vessel. DVTs are the main cause of pulmonary embolisms. So this dislodged thrombus is also known as a thromboembolus. So some background information on DVT and PEs. There's a significant amount of blood clot diagnosis a year here in the US, about 10 million cases. PEs are extremely dangerous as they're the 3rd most common cause of cardiovascular death. And some other stats for you. Roughly between 60,000 and 100,000 Americans die each year from DVT/PE, and estimates show between a 10 and 30% chance of people who are affected will die within 1 month of diagnosis. And of course, this is considering the fact that these patients are not receiving treatment. And as well, that those affected from DVT or PE have about a 33% chance of reoccurrence in the next 10 years. Risk factors for DVT. So due to the high risk of developing blood clots in cancer patients, there's a very high risk of hypercoagulability, meaning cancer patients are more prone to developing blood clots. As well, various traumatic injuries and things like prior diagnosis, being overweight, also greatly increase the chances of a DVT episode. As well, some genetic diseases, such as a mutation in one of the clotting factors called factor V Leiden, also places the patient at a much higher risk for developing DVT. So as we get into the pathophys here, remember that there's going to be a couple of steps that lead to the final diagnosis of PE. So first, that thrombus or blood clot will form. Typically, as I said, it's going to be in the lower extremities, whether that be the calves, the thighs, or even the hips sometimes. So second, that blood clot will leave its original location and travel through the venous system and lodge itself in the pulmonary arterial system, where the blockage of blood flow continues. And it's this 3rd step of hypoxemia, or lack of oxygen in the bloodstream, where we'll start to see the patient present with signs and symptoms like tachypnea, dyspnea, decreased PaO2 levels, pulmonary hypertension, and eventually shock. So this diagram here shows a nice simple version of the path that the blood clot will take. So on the left here, you can see that the thrombus has been lodged in the patient's left thigh. and eventually part or all of that blood clot will break apart and travel up the vein and lodge itself in a pulmonary vessel, causing that backflow of blood to that specific lung. So symptoms of DVT will sometimes include pain, redness in that lower limb, and this is due to inflammation. But really, the patient will usually present as asymptomatic, and this is due to how deep those lower extremity veins are. However, a significant blood clot can cause edema. And so once that blood clot in the lower extremity dislodges to the pulmonary system, as I said, this is when we'll start to see symptoms which include sudden shortness of breath, sudden chest pain, increase in heart rate and respiratory rate, difficulty breathing, and extreme anxiety. As well, throwing up blood or hemoptysis and syncope are also possible. And keep in mind that clinical examinations often have a low sensitivity in detecting clots. As I said, that's due to how deep these veins are in the lower extremities as well as the thighs or hips. So to diagnose DVT, you can have a Doppler scan. This would be to confirm that the blood clot is indeed present. So this imaging uses sound waves to look at the flow of blood and can detect blockages that are deep in the veins. As well, there's what's called a D-dimer test, which looks for D-dimer in the blood. D-dimer is a protein fragment that's produced when a blood clot dissolves in the body. So a positive result of the D-dimer test would indicate that there is indeed a significant thrombus in the body. However, this test is only a measurement. It does not tell the location or the cause of the blood clot. So really using both the D-dimer test and a Doppler ultrasonography ensures a more accurate result to diagnose a patient with DVT. So finally, treatments for DVT and PE include various anticoagulant therapies. So most commonly, that's the use of warfarin and heparin in combination, as well combining those anticoagulants with thrombin inhibitors and thrombolytics set up your patient for a significantly decreased risk of developing another DVT episode. However, if a patient, for whatever reason, cannot take those anticoagulants, a filter will be placed in the inferior vena cava, and this is so it prevents the emboli from reaching and traveling to the lungs, essentially preventing a pulmonary embolism. As well, these therapies would need to be continued over time, even once the patient has stabilized. So this concludes my PowerPoint on thrombosis / deep vein thrombosis / pulmonary embolism. Thank you.